Craig Keys. I'm a physician, a gay guy who loves sex, who loves the medical profession and medical care, who loves people, and who wants to make a difference. It's hard to imagine a job that really includes your passion, all of your passions. My practice now is men's sexual health. I'm trained, doubly boarded in internal medicine and geriatrics. And before you wince at the idea of geriatrics, know that it's a fascinating study of the range of challenges that we face as our bodies age, according to the plan that evolution has laid, and in a culture that really doesn't like that plan. And that's why we're all so cranky that our bodies aren't keeping up with us. And so it's a fascinating way to approach how do we reconcile those differences? And how do we make it possible for people to live richer, fuller lives when evolution hadn't planned for that? When the pandemic started, there was the lockdown, everyone was so frightened, and they became more and more disconnected. And the stories became more compelling to me. One guy said, I really need this help because I've reached the end of my options in terms of having a connection. I no longer participate in anything you might consider sexual, but it's a fetish. I've turned to candle wax and clothespins just to have a platform for connection. And sorry. And that's really powerful. You hear that and you just think, whoa, I am so lucky and I have so much work ahead of me. And so you realize that this runs so much deeper than merely assisting someone in having sex. It's really about connection. And I went through my own transformation in terms of recognizing the power of physical intimacy as a gateway to emotional connection. And all of that added up for me. And boy, did it come in spades when the data came in from the National Council on Aging. There were a number of studies that were begun in the early 90s, appropriations from at the federal level for studies about what happens as we age. And there were a jillion different questions. No one intended for it to be a study on sex, but those were some of the questions included. And they told us that men in particular who step away from sex with another partner or partners have a serious and more rapid decline in their cognitive skills. This isn't, are you unhappy or are you not getting the cardio you used to? This is, can you solve a complex problem, what we call executive problem solving? And the negotiation with another partner for sex and what you want to get, knowing that you might want to come back and get some more later, is a sophisticated negotiation and requires problem solving skills. And that's why it seems to be a vastly better approach to maintaining cognitive skills than, say, Sudoku puzzles.